My prototype presentation is about the role of my IT project. The reason I came up with it is because I thought it would be a benefit for the pre-op clinic nurse to improve efficiency and also thought it would improve the ambulatory surgery patient experience. But during the last 5 weeks, as I read through the materials and came to understand that technology is a tool, not necessarily the solution, I decided to find out from the patient themselves about the efficacy and importance of the patient portal for them. The first thing I wanted to learn was whether or not the patient was utilized by asking if the patient knew what a patient portal was, utilized one already, if so, what did they like about it, and if not, why not? I decided to question those patients who had appointments in the pre-op clinic, and during my interview would show them my idea relative to a patient portal and get their thoughts. This was the potential outline of the patient portal. I showed them a mock of what I was thinking. They liked the pictures, and it appeared to be simple, assuming they would just press the picture to get specific areas. I first asked them if they utilized a patient portal or knew what one was. I interviewed 7 patients, 2 patients during their pre-op appointment, and 5 prior or after their pre-op appointment. The range of ages were between 52 and 62 years of age. 3 of the patients utilized a patient portal. They were all women. 4 did not. Out of these, 2 would use if they had the opportunity, women also. 2 did not know what a patient portal was. Both were men, ages 52 and 59. Of the 2, 1 did not care about using a patient portal, or would if they had the opportunity, because it would be a good way to obtain information, and it is the way of the future. I asked patients if we were to implement a portal and had to start with one aspect, which would be the most important. Most of the patients didn't pick this feature, diagnostic medical tests, as the most important, but 4 of the 7 liked the ability to review the results, and most of them wanted the ability to discuss the results with the physician. The other 3 felt it was too much information that didn't mean much unless someone explained it to them, and at least 2 of them stated if it was important, the doctor would discuss it with them, so they did not need to have access to these results. This was probably one of the most popular features. One patient stated that she would appreciate this, especially for post-discharge, because she had time to review the videos while she is recovering. One person stated more about anesthesia would be helpful because it can be scary and unknown as to what to expect. One of the patient's spouses thought this may be helpful, but her husband, who was the patient, didn't care. Knowing less is better for him. If I need to know something, I just look it up on Google, was another comment. People asked if it would be available in multiple languages. One person made the comment that as long as the video is short, and then there was mention of the elderly and how many do not have computer access to one. I also showed them the brochure for what to expect the day of the procedure and how this information would be posted on the website for those that like to read information. Most liked the idea, and one stated she preferred to have the brochure. Something in her reminded me of what I had learned during one of my initial classes, and how people are all different on how they absorb and understand information, visual, audio, or kinesthetic. This feature, medications, was picked the least. Surprising, but then realized that most of the people I was interviewing did not have a big list of medications, therefore did not see the value of this feature. But then I mentioned it could also be medications prescribed for after surgery and could have information about their side effects. I thought of this while I was talking with them. Some thought this was important, and it would be great to have a list of medications handy, especially for those patients who had lots of medications, like their parents. For this group, they did not find value for themselves. I explained this feature would be utilized to complete this form. They liked the idea of being able to enter medications at leisure, and for the nurse, it would be easy to read because it would be typed versus written. Interestingly, about half of the patients I spoke with thought this feature, communication with healthcare provider, was the most important. It was usually those who already had experience with patient portals and found this very helpful and expect it would be important in this type of scenario. Outpatients also of interest. Out of the 3 options provided, no one asked for video. Email was number 1, and a phone call would be nice but not expected. At first I thought this was surprising, but then realized the age group, and being part of that age group could lead to wanting privacy and less exposure. Probably that was least chosen as most important, yet this is the main reason I started this project in the first place. Having forms completed prior to surgery was why the pre-op nurse supported the idea of the patient portal. This would help her have the necessary, included medication list, the medication history that was clear and easy to read. One of the patients didn't like the idea of this feature because she thought it involved reading and faxing or scanning back, and stated that elderly patients would find this process confusing. I told her that my idea was to have it all online, exported to the patient's hospital medical record, but it would also have the feature for printing for those who wanted it. When I showed them the forms that the patients are expected to complete prior to surgery, I asked, wouldn't it be easier to complete these online rather than write them out? Most agreed this is a good feature, but what about those who don't use or have a computer? And interestingly, people made mention about elderly patients again, and how this idea of the patient might not be such a great idea for everyone, but that there should be an alternate option. I assured them that we would continue to have person-to-person appointments because some do better that way. And as for the patient portal, we are in the and research phase of this project, the main reason I'm speaking to them. In summary, just because you build it does not necessarily mean they will come. It was an eye-opener for me to and appreciate the phase of prototyping to determine problems, concerns, issues for the end user. I realize this was a small sampling and generally represent the average age of the type of patients who benefit most, those who require the most time during pre-op, but their input was insightful and helpful for determining next steps, which would be to interview those patients between the ages of 65 to 75 for a more realistic understanding of their perspective. I also look forward to hearing from you as to your experiences and/or insights relative to the utilization of a patient portal. Thank you.